Thank you. We are moving now to the final session on Symposia. And basically, one of the things that we had in mind was to put together Symposia on how we could change research into Dupuytrens. Lots of things have happened in the last 10, 15 years around this, particularly in the last 5 years. And we've gone from doing our own research in our own units and collaborating. And we are collaborating across all tiers, right from the cell level, the matrix level, the genetics, the clinical intervention level. So we are collaborating across patches. So here are what the next two symposia are going to try and address is what should our priorities be? I think your mention about patients was so correct because I do think that maybe patients should be driving and letting us know what is important. So there should be a patient focus. Maybe we need to explore treatments in a much more rigorous way and investigate what triggers it, what triggers Dupuytren's. We understand the cells, we understand the biomechanics, we understand the matrix, we understand about splinting. So we've got all these snapshots that we have seen over the last 2 days, and we now need to start drawing all this together into a single cohesive picture for us then to start making judgments again. So I think that is one of the areas that maybe all of both, right from basic, right up to the bedside, everything needs to be looking at things in a cohesive way. And then we need to look at how can we improve collaboration, and we need to put aside our institutional areas and our biases within our own systems and see how we can contribute to each other. And of course, the most important thing in all this is how do we get it funded? And I suspect the key is collaboration. So what we're going to do is we're going to hold two symposia. The first is around basic science, which will be led by David O'Gorman. And then we've got Marie, who's in fact comes from a basic science background and is now going to lead the clinical section on clinical research. And then we'll wind up after that. Right, I'll hand over to David.